Welcome to Who Are You, the Bobcats you know, the stories you don't. I'm your host, Joel Vanner, inside the podcast studio at Quinnipiac University's School of Communications, and I am joined today by my guest, Morgan Pastir. Morgan, welcome to the show.
Thank you. Thanks for having me.
I'm sure you could guess by the name of the program what my first question is going to be. We know your name, but tell me, who are you?
I'm Morgan. I am a two-time Quinnipiac alum, and I'm a registered nurse.
Welcome to the show. Two-time, outdoing me by 1 degree there. What was your first degree in at Quinnipiac?
My first degree was in psychology.
Psychology. Mm-hmm. What got your interest in psychology?
So in high school, I took an AP Psych class, and I thought it was super interesting, like how the brain works, why people act the way they do. So I went with it.
And you decided that that was something you would maybe want to pursue in college?
Yeah, I was kind of unsure what I wanted to do, what direction I wanted to go. I was applying to a bunch of different schools and I liked it. So I was like, let's just go with it and see where it takes me.
What about Quinnipiac drew you to accept your offer and come here?
I applied to a bunch of schools and I didn't really know if I wanted to go far or stay close. But when I got my Quinnipiac acceptance, I was the most excited. It was close enough to home, but far enough. And I was just so excited. It just felt right. So.
And your time in the psychology program, what kind of courses did you take and what did you learn through those studies?
There are so many different psych classes here. There's abnormal psych, and then there's children psych and family. There were a bunch of different directions and paths, and it was interesting to see how many different components of psych going from one class in high school to a huge array of classes here.
Was there a time in your psychology program that you were like, maybe this opened my eyes to something else that I may want to do?
Yeah, so psych was always interesting, but I didn't know if I could do that career-wise. I didn't know if I wanted to further my education to the PhD level where then I'd be able to prescribe and have potentially my own practice. So I thought it was interesting, but I didn't know if I could do that long-term as a career. So I kind of shifted midway through college and changed my focus a little bit.
What did you change your focus to?
I thought I would maybe try dentistry, which is even more schooling.
Okay. Do you like the dentist?
I like going to the dentist, which I know is kind of weird, but I'm
sure the dentists love to see you on the schedule.
They do. They're like, Morgan loves coming here. So then I met with an advisor, and she kind of guided me through the transition of changing my focus.
And who was your advisor?
Anna Gilmore.
And she leads the pre-dental studies advising?
She does everything. That woman is amazing. We had a general meeting where she talked about just pre-med and pre-vet and pre-dental, and she is in charge of all those things. And she just sat me down and told me how to do it. And she was like, this is what you have to do to get there. And if you're going to put in the work, you can do it.
So what did she advise you to do to pursue that track?
She told me to stick with psychology because I thought I would have to change my major to like chemistry or something like that. And she said, if you like psychology, stick with it and take all the prereqs for dental school because there's not a pre-dental major. It's kind of like a path. And so she told me to stick with psychology and then just take all the prereqs for dental school. And
you were also in the student organization, right, for those interested in dental studies, right?
Yes. So there was a group of us who were pre-dental students, and it was actually pretty cool. We went to NYU, we traveled to different schools and went to the open houses, and we were like a tight-knit group, and those people were really interested in dentistry.
So you were in the organization, you probably shadowed some orthodontists, dentists, right? But you're not a dentist.
No.
Tell me how that decision came about.
So I did. I shadowed everyone, orthodontists, my normal dentist, everyone. And I asked my dentist if he would ever go back to dental school. And he was like, Morgan, I would never go back. And so that's
a ringing endorsement.
Yeah, it made me realize, like, okay, I knew it would be a challenge, but he's already completed it and he wouldn't do it again. So it kind of made me reevaluate, do I really love it or do I just think it's interesting? And so it kind of took me a minute, and I was like, maybe I don't want to be a dentist.
So don't want to be a dentist, but you learned a lot probably through that whole entire experience, and you made connections. So you graduated with your psychology degree. And what came next for you?
So after that, I knew I enjoyed people, talking to people, wanted to do some form of healthcare. So I was a medical assistant for a year. And throughout that, I kind of dove deeper into healthcare. And that's where it kind of brought me to my next step.
Was it in a certain specialty?
It was in a vascular office. So veins and arteries and stuff like that. I thought it was interesting. And it was in my hometown. So it was close to home. I knew some of the people that worked there, so it was a welcoming, fresh out of college environment. And
it was another place to learn, gain all that experience. And that led you to your next program here at Quinnipiac, which was the 12-month Accelerated BSN RN program, right?
Yes. So I was at the medical assisting office for a year, and I took some prereqs, and I was like, I had this one nurse who was fantastic, and she was like, you can be a nurse. You would be a great nurse. Why don't you look at some programs? And then I found Quinnipiac's, and I was like, okay, I've already done 4 years. I just want to get in and out. I want to be a nurse. How can I do it? And Quinnipiac had a 12-month program, and I was like, let's apply and see what happens.
Is that unique in the, I'm not familiar, is that unique in the world of accelerated programs, the 12-month?
It is, because a lot of programs are 15 months. So, or maybe 16, but it's longer. And so I wanted to do a program that was, you dive right in, you just immerse yourself in all things nursing, and Quinnipiac had the 12 months. And so I was really hoping, I applied to a couple programs just in case, but I was really hoping that I got the 12-month Quinnipiac. I loved it here. So it was just, I want to stay here if I can.
And accelerated, it sounds intense, just by the word.
Yeah.
What has been your experience like in the program?
Honestly, I was more scared than I probably needed to be. 12 months and a whole nursing program is kind of intimidating, but...
And you're still trying to figure out where you want to be too, right?
Which
Psychology, dental, medical office. And
once you get here and you meet your cohort, it's a pretty small cohort. I think there was 70 of us, and you all become friends. You go through it together. Everyone helps each other. And once you join and start, it's definitely a challenge, but it's not as hard as I thought it would be.
What was like a typical day in the program like for you?
Every day was kind of different because there were just so many aspects of our courses and our labs. So we would have class days, and then we would have lab days, but there were different types of labs.
And these are on the North Haven campus, right?
Yeah, everything was on North Haven. So we would have our classes, our labs, and then our skills, and then clinical. So our skills labs was more how to like spike a bag and how to take vitals. And then we would have patient simulations. So we would actually get to work with actors who were trained to be patients and got to practice in like a safe environment and get feedback from our professors.
They're watching you on the outside the room.
They're watching. Yeah. And then you give your peers feedback, they give you feedback, and then you have clinical where you like practice with real patients. So we kind of, and they would schedule it so perfectly. We would have our cardiac class, our cardiac vitals, and then our sim with our patients, and then our real patients. And so it was just kind of like this group of topics was all in each of the different aspects. And then you get to practice on your real patients, which was...
What was that like? So the standardized patients, they're paid actors, right? Mm-hmm. They have a script that they follow. What was that like going from kind of like a safe space, planned to, you're out in the real world with somebody who's not an actor who has a real medical concern?
The actors are really good. Sometimes you just think they're actually sick and have the conditions they have. I think transitioning to real patients, it's tricky because like you don't want to wake them up and you don't want to interrupt them at all. You want to let them sleep. But getting to practice with the standardized patients, it gets you familiar with how you're going to say things and how you can approach different things. And then getting the feedback is just so helpful because then you know how a patient would actually respond most of the time because these actors really make you feel like you are in the hospital.
It probably took some of the fear away from what you may see when you're seeing actual patients, getting to experience that with a standardized patient. Because it's an accelerated program and it's 12 months, which you said is unique, and I'm sure others in the cohort had other life circumstances going on while they were in this program too. How did the faculty in the School of Nursing support you and the cohort throughout the program?
They were fantastic. Our program director, Phil, he would work overnight and then come to school, teach us a class, and then if anyone was confused, there were some topics that are just not easy. And he would host like Zoom sessions after class, which was just not even a part of the curriculum, anything. He would just make sure we got it. And he would have little mini PowerPoints that were just focused on the really hard to grasp concepts. And life does happen. And some of the people, you go through stuff, things happen outside, and we all just as a cohort knew that we had to finish, we had to graduate, and we just would work together. Some people would make study guides and send it to everyone, and Phil would just come extra and help us if we needed it. And it really is a team effort. It's not, oh, I want to outdo you. We all want to pass. We all want to pass the NCLEX and just be nurses. And the group and the faculty and just the cohort all together, we all made it happen.
So you had these experiences on campus. What were your clinical experiences in the program?
Clinical was so fun. So we used to drive together as a cohort. We would get coffee before and go together. And I actually had this one professor, Laura Conklin, who is amazing. And I would have her in the standardized patient class, and then I would have her at the hospital. And she was so kind. She got me pizza on my birthday, and she just made us feel so comfortable. She would give us feedback, and she would make it such a safe space for learning. And then I would get to be with her at the hospital and in those patient rooms. So I was comfortable because I knew I had her. She's so smart. She's one of the best nurses I've ever worked with. And it was just so exciting that I got to transition from the classroom to the hospital with someone I'm comfortable with who's so smart. She's not going to let me make a mistake. She'll let me learn, but she's a great backup to have. And she's the best. And
that connection prepared you for your second experience with the VA, which was a residency program.
Yes. So Laura works at the VA, and she told me about this residency program that they had. So she said, when you're done, I really think you would benefit from this. You get to do a full year, and you rotate the whole hospital. So you get to see the ICUs and the emergency department and med-surg and try everything. So she guided me to the people who I could apply for that position. So then once I graduated, I actually got to be a colleague with her. That's awesome. Mm-hmm.
How did what you learned in the program prepare you for a residency program like that? You had Laura there, as your now colleague after being your mentor and working alongside her. But how did what you learned prepare you for an experience like that?
I think the classroom, you learn the content, but then the standardized patients and clinicals get you transitioning to, okay, I'm going to be in the hospital. People are really sick. You really need to stay on your toes, make sure you're looking at the whole picture. I think the different components of learning really prepare you for that because you get the content. What are these medications doing? What is the body doing? Then you get to practice with your patients, standardized and in clinical. So it's kind of like the perfect combination of learning the content and getting to practice. So it kind of launches you into that, okay, I'm ready to be a nurse and have my own patients, and it does prepare you. But there's always going to be, nursing is a crazy field to get into. So you do learn some stuff, obviously, once you start, but it definitely gives you the foundation you need.
And you have that rotation that put you through all different areas of the hospital too. Is there one you landed in now after the VA?
So I was at the VA, and I really loved the higher acuity patients, having to use your knowledge more. And so I actually ended up in the cardiac ICU at Yale. And I always knew I wanted to do something higher level, something with people who are more sick, when we were in med-surg, Dr. Martinez would always talk about, okay, this is the basic, but if you do get to the higher level, this is different measurements and different things. And he always would talk about this wedge pressure. And it was kind of confusing in nursing school, but now I'm in the cardiac ICU and I know exactly what he's talking about. And I'm like, oh my goodness, I'm at that higher level now. And I know what he was talking about. And it's all coming together. And you learn stuff in school and you learn stuff in your first year, but there's always more learning in nursing and new technology. And it's crazy to kind of be like, oh my gosh, Dr. Martinez talked about that a couple of years ago, and now I'm practicing it.
And you probably tell him, you say, hey, remember that thing you said a couple of years ago? Now I'm actually experiencing it.
Yeah, and my preceptor, so when you start in a new unit, you have to learn the unit, especially the high acuity where I am now. You practice with someone, and they're your mentor. And so my preceptor is actually back in school, and she was like, oh, I work at Middlesex. And I was like, oh my gosh, what are the odds you've met Phil Martinez? And he's actually her preceptor because he still works as an APRN. So she gets to work with him. And I'm like, what a full circle moment that you're teaching me and he's teaching you. And it
sounds like you were just never destined to go to dental school. All these connections came together for you.
No dental school. Still love the dentist, but definitely love nursing more.
So continual learning in the program, in the field, you continue to learn about yourself as you progress through your psychology degree and then went on to the accelerated program here at Quinnipiac. What advice would you give to someone who maybe isn't sure if they want to enter a healthcare-related field or an accelerated program like the one you did here at Quinnipiac?
I would say do the things you're interested in and take a variety of classes. Psychology was interesting to me. The sciences were interesting. I liked biology. But once I took anatomy, I was like, oh my goodness, the human body. It's so incredible. And
anatomy is one of those courses that I think people are like, whoa, there's a lot there.
And definitely talk to your advisors because they've seen people go through these journeys. You have advisors in your majors and then you have general advisors. So I had a psychology advisor, but then I also had Anna Gilmore who knows the pre-dental, the pre-med, the pre-vet, and they've seen people go through this journey and they really know how to help you and guide you in the right direction.
And shadowing was a big part of your journey too.
Shadowing is huge. You might think you love something, shadow. Try a bunch of different things because then you see, okay, this sounds fantastic, but these are the frustrations. Every job has frustrations. You see what's worth it, what's not worth it, the paperwork, the stresses. Shadowing is huge.
And you'll build your network along the way, and you may also have some crazy connections when you're in the field too.
This is true.
Well, Morgan, thank you so much for joining me on the show today and sharing your experience here at Quinnipiac and your success in your career so far.
Thanks for having me.
If you like today's episode of Who Are You, be sure to like and subscribe and find other episodes of our show on Apple, Spotify, and YouTube podcasts. Until next time, when I ask my next guest, who are you? I'm Joel Vanner. Bye for now.